Today, we're diving into a crisis that's shaking the very foundation of healthcare. It's not about a new disease or a wonder drug. It's about something far more fundamental: trust.
Let's just start with this one single number, 40.1%. That's the percentage of U.S. adults who said they trusted physicians in early 2024. Now get this, back at the start of the pandemic, that same number was over 71%. That is a massive, staggering drop in just a few short years.
So, what's going on? This isn't just a number on a page, right? This has real-world consequences, leading into things like lower vaccination rates and just worse health outcomes for a lot of people. So today, we're going to dig in. We'll unpack the roots of this mistrust and then explore some really cool, innovative ways people are trying to rebuild it, both from inside the system and from the ground up.
To even begin to think about a solution, we first have to get our hands dirty and dissect the problem. And let me tell you, this decline in trust isn't simple. It's this tangled web of causes, with threads coming from way outside the healthcare system and from deep within it.
A huge external factor is something experts have started calling an infodemic. You can probably guess what that means. It's this overwhelming flood of information online, where solid facts, wild rumors, and straight-up falsehoods are all swirling around together. It makes it almost impossible for anyone to figure out what's reliable. And this quote really hits on a crucial part of the challenge. The very people we need to hear from, the doctors, the nurses, the scientists, they often feel like they can't speak up. They're afraid of being attacked online or even getting in trouble at work. And that fear creates a vacuum, a void that misinformation just rushes in to fill.
But, we can't just point fingers at the internet. A huge piece of the puzzle is the failures happening inside the system. When communication breaks down, whether it's between two doctors or between a doctor and a patient, trust just crumbles from the inside out.
A big study of patient safety events really paints a clear picture here. You know what the most common communication failures were? It wasn't some super complex medical mistake. It was basic stuff. Not following standard procedures, messy, unclear written notes, or sometimes just no communication at all. And these seemingly small errors can have huge negative consequences.
But the problem goes even deeper than just how we talk to each other day to day. It really gets at a growing concern people have about the credibility of the entire scientific process itself. Is it really as transparent and reliable as we think it is?
Okay, take a look at this practice called harking. It's a bit of a mouthful, I know, but the idea is simple. Imagine a researcher finds something they totally weren't expecting in their data. So they go back and rewrite their whole paper as if they meant to find that thing all along. It might seem harmless, but when you do that, you're undermining the whole scientific method and making the research way less reliable. It's little things like this that chip away at trust over time. All right, so with trust taking hits from all these different angles, what do we do? How do we fight back? Well, the good news is a lot of medical schools and scientific organizations are waking up to the problem, and they're starting to develop new game plans to rebuild that trust from the inside out.
Medical schools are completely retooling their playbooks. They're training the next generation of health professionals with some really critical communication skills. Things like motivational interviewing, which is all about helping a patient find their own reasons for making a healthy change. These aren't just buzzwords. They're proven, evidence-based ways to build real, collaborative, trusting relationships.
And to tackle that bigger science credibility problem we were just talking about, there's a whole movement called open science that's all about making research more transparent.
A key part of this whole movement is something called pre-registration, and it's a deceptively simple but incredibly powerful idea. Before you even start collecting your data, you publicly post your entire game plan, what your hypothesis is, how you're going to analyze everything. By doing that, you make it literally impossible to hark. It draws a super clear line between what you planned to test and what you just happened to discover.
So this is basically the workflow. First, you pre-register your plan. Second, you document everything so someone else could repeat your steps exactly. And third, you share your data openly. This whole process creates this transparent trail of evidence that anyone can follow and check, building a much more credible and trustworthy foundation for science. Now, all those big institutional reforms are absolutely critical, but they're only half the story. Some of the most exciting and powerful solutions are actually bubbling up from communities themselves, from the ground up. And at the absolute heart of these efforts is health literacy. This is about so much more than just being able to read the label on a prescription bottle. It's about empowering people with the skills and the confidence to navigate our incredibly complex health system, to know what questions to ask, and to feel like they can make truly informed decisions for themselves and their families.
And the impact here can be just incredible. I mean, look at this. A program focused on boosting health literacy for parents in Head Start communities saw these kinds of results: a 75% decrease in emergency room visits. That's not just saving the system money. That means healthier kids and fewer scary, frantic nights for parents. It's proof that when you empower families, amazing things happen.
Another really powerful model that's getting more and more attention is mutual aid. This is basically when people in a community get together and organize to directly support each other, filling in all the gaps that the formal systems so often miss.
And this quote is the guiding principle. Solidarity, not charity. Mutual aid is not about a top-down handout from someone with power to someone without. It's about building horizontal networks of care, based on the idea that we're all in this together and everyone has something valuable to contribute.
And this is not some brand new idea. It has a long, powerful history. From the Black Panther Party's groundbreaking free breakfast programs back in the 60s, all the way to modern-day neighborhood support pods and migrant aid networks, people have always organized to take care of one another when the system falls short. Okay, so we've seen the problem from a few different angles, and we've explored solutions coming from two very different places: big institutions and grassroots community action. So the real question is, how do these two paths come together?
Well, it becomes pretty clear that what we need is a two-pronged attack. On one hand, we absolutely need those top-down institutional reforms that make our healthcare and scientific systems more transparent, more credible, and just plain better at communicating. But at the exact same time, we need those bottom-up, community-led efforts that empower people with knowledge, skills, and networks of mutual support.
And here's the most crucial point of all. One can't really succeed without the other. Think about it. An institution can be perfectly transparent, but that won't matter if the community doesn't have the health literacy to engage with that information. And a community can be incredibly empowered, but they'll still run into walls if the system they have to rely on is fundamentally broken or untrustworthy. They're really just two sides of the same coin.
At the end of the day, rebuilding trust isn't something that just happens. It's an active process. It's built through thousands of actions, both big and small, every single day. And that leaves us with a final, really important question to ask ourselves. In our own lives and in our own communities, what is our part to play?